Over the centuries, numerous doctors discovered that emotions can cause diseases, but their findings mysteriously disappeared. The author mentioned that most of his patients with serious illnesses never learned to say no and were emotionally repressed. The mind and the body are connected and there is no separation. People with malignant disorders often deny strong emotions like rejection, pain, or sadness. Shame is the most toxic emotion people face. Some try to avoid it as a result, and it prevents people from seeing reality. Studies have shown that emotional distress may be linked to MS. 90% of MS patients experienced a traumatic life event before the onset of their symptoms. People who are entangled with their parents and have no psychological independence are also at risk of suppressed anger. The awareness that one can't cope with a difficult life situation or is stretched beyond one's ability to handle the stress also places one at risk for illness. Conditional helplessness, rather than responding with fight or flight, leads to repressed stress that feels normal to a person with unmet needs or to those only meeting the needs of others. Interacting with others emotionally affects people on a biological level. Medicine still views body and mind as separate entities, despite evidence to the contrary. Stressful, sudden life events such as divorce or unemployment are harmful. Still, minor chronic stress can be even worse for health. Stress is not subjective. It can be measured physiologically in the body. It affects the brain, immune system, hormones, and other body functions. Stress happens when the demands on a body are higher than it's capable of sustaining. Pressure can occur during emotional trauma, and even when there's a threat of such trauma. Even if a threat is not within conscious awareness, it can still cause a physiological stress response. Even so-called good stress can cause disease. Alan was diagnosed with esophageal cancer after a difficult 10-year stretch of marriage with his wife and acid reflux. Alan said yes to everything enthusiastically and learned to say no after his diagnosis. Cortisol affects almost all body tissues and determines stress reactions in the body. Cortisol dampens stress reactions and immunity. Stress threatens homeostasis and can be natural or perceived. The body sees the threatened loss of love, food supply, or shortage of something that is required for your survival. For most people, emotional stressors are the most important and the most prominent. Since most stressors in the modern world are emotional, ALS patients usually have a lifelong pattern of being unable to get help or ask for it and take care of others, and they exclude negative feelings from themselves. ALS patients tend to be too nice. Emotional expressions come off as niceness in their case. These type of ALS patients have loss or neglect in their childhood. One patient mentioned in the book with ALS was extremely loyal even when there was harm in being faithful to a person. ALS patients are often overachievers or workaholics. Niceness is a facade. One patient had difficulty finding himself with his mother since she was domineering and insensitive to others' needs and wants. The public layer that people show is sometimes their most superficial one. Stephen Hawking also had ALS. Most patients with ALS die within 10 years, but Hawking lived for decades after he was diagnosed in his 20s. Hawking wasn't comfortable with his body before he was diagnosed, and he was bullied. 400 women were asked what they thought caused their cancer. Most said it was stress. Research shows that stress is linked to breast cancer, but not genetics. Only about 30% of women with genetics predisposing them to cancer get the disease. The genes have almost no effect on men when it comes to this type of cancer. Hormones and emotions shouldn't be separated. Estrogen aids in tumor growth while other hormones eliminate malignant cells. Those who got more emotional support were more likely to survive an illness, no matter its progression. Women were likely to develop cancer if they were altruistic, had distant parental relationships, and if they repressed their anger. Internal stress comes when one can't cope with adjusting to someone else, and when one lacks a sense of independence, and this causes illness. Even if one is intellectually brilliant, it doesn't mean they are emotionally intelligent. People overdevelop in one area of their life when they're underdeveloped in another one. Sometimes people don't feel unloved even when there's a lack of love because they shut off their emotions. Conflict, uncertainty, and lack of control cause the most stress on the body. A lack of love or unmet emotional needs can also cause health issues. Consumatory behaviors are those that relieve stress. The consummation of needs gets rid of the stress response. Stress and emotional repression can damage DNA repair and apoptosis, also known as cell death. A disease develops in a disordered body and doesn't just come out of nowhere. An ailment depends on the host environment for survival, also known as the body, that's the host. The tissues can either be hostile or receptive to cancer and other diseases, and are sensitive to women's states of mind. Diet affects how hormones function. Emotional loss and separation were linked to lymphoma and leukemia. This is why trauma can really mess a person up. The inability to show emotion or repressing your feelings is the top risk factor for cancer because it puts stress on the body. How do you show your emotions? This emotional repression goes along with a lack of support and hopelessness in many cases. Married men were less likely to have prostate cancer than the divorced and widowed. The good news is that it's mostly curable now. The next portion of this book summary is coming soon, so stay tuned. Thank you for watching. To your health and prosperity.